everyone, and thank you so much for joining today's NeedyMeds special topic webinar, Becoming an Empowered Patient, presented by Mended Hearts. My name is Carla. I'm the Director of User Engagement at NeedyMeds, and before we get started with the presentation, I'm going to offer a few tips so you can make the most out of it. First of all, if you do have questions, you can go ahead and type them into that questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. We'll try our best to get to all of them, but in the event we don't answer your question, we will, of course, follow up with you by email and provide our contact information at the end as well. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can find both of our PowerPoint slide decks and other material we thought you'd be interested in that handout section of your GoToWebinar control panel. So let's get started with what is NeedyMeds. Now, for those of you that are not familiar with us, NeedyMeds is a national nonprofit dedicated to educating and empowering those seeking affordable health care. And you'll see that that's our mission right on the screen, along with a statement about how we achieve that mission, as well as our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through a helpline, 1-800-503-6897, and a website, needymeds.org. And I always like to put up a screenshot of our website because it's really the face of our organization. And it gives me the chance to point out a few things. If you're looking at healthcare savings, start by clicking on that Healthcare Savings tab. If you would like to sign up for our newsletters, email alerts, order brochures, find out what other webinars are scheduled, and tons more, click on that Education tab. I mentioned just a moment ago that this webinar is being recorded and will be posted to our YouTube channel, and you can find our YouTube channel icon and a link to that channel on the top right of our homepage with the rest of the social media icons. Anyway, as you just saw a couple of slides ago, a big part of our mission is to educate people. And we define that by educating people about NeedyMeds, but also by educating our users about other important resources and healthcare topics, which is why we are so pleased to have a guest from our partner, Mended Hearts, here with us today. Mended Hearts is a national and community-based nonprofit organization that has been offering the gift of hope to heart disease patients, their families, and caregivers. Their mission is to inspire hope and improve the quality of life for heart patients and their families through peer-to-peer support. Yet today's webinar is going to touch on a subject that is important to everyone, not only heart patients, which is how advocating for yourself and being an active part of your own healthcare team can improve your health. To walk you through this important topic is my friend and colleague, Andrea Baer. Andrea has a Master of Science in Nonprofit Management and Leadership. She's a board-certified patient advocate and is the Executive Director of Mended Hearts. She has been deeply involved in advocacy efforts and working to assure that the patient voice is at the table. Andrea resides in Pittsburgh, Pennsylvania, with her husband and 4 children, but we're fortunate to have her here with us now. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Andrea. And as she grabs that screen and opens up her PowerPoint presentation, it's a good opportunity for me to remind you all that if you do have questions, again, you can submit them by typing them into that questions section of your GoToWebinar control panel. And with that, I'm going to go ahead and pass the mic to Andrea. Thanks, everybody, and enjoy the presentation.
Thank you so much. And it is a pleasure to be here today. As Carla said, I am Andrea Baer, the Executive Director here at Mended Hearts. And our mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. We've been supporting patients since 1951, celebrating our 70th anniversary this year. We have over 200 chapters across the country, serving 300 hospitals and over 60,000 members. But I want to start by talking just a moment about myself. And the reason that I do that is because we always like to know how you become an expert in the fields that you're speaking about. My expert on my journey was not through my education or my work background. My son was born in 2009 with a congenital heart defect and Down syndrome. He had to have an open heart surgery at 11 weeks old. He has had 6 surgeries and multiple hospital stays in his short life. And navigating his care was daunting and scary. Before he was born, and he was my 3rd child, the healthcare decision making was a foreign concept to me. And finding online resources I found quickly was just a big pit of despair. And I felt alone even when I was surrounded by family and friends. And I bet that some of you will probably understand this feeling. I was very confused and overwhelmed, very at the mercy of doctors, out of place in conversations about medical care. So I felt like I needed to just have blind trust, right? I mean, the doctors know best. I don't really feel like I have a place to ask questions. I'm just going to go with whatever the doctor says. Well, I found quickly that you get in life what you have the courage to ask for. And this is one of my favorite quotes by Oprah Winfrey, because if you're not asking the right questions, you don't know what you're missing. And so I have made it my personal journey for the past 12 years to truly empower patients to take responsibility and ownership of their own health care and their own heart journey, and making sure that they understand the why so that guidelines can be applied, making sure that you can weigh the impact of decisions on all of the stakeholders. And that allows for making more trade-offs, not less. But most importantly, for you to remember is that empowerment is an earned privilege, not a given right. You have to really work at it. We can all be patients, but we must learn to become empowered patients. Empowered patients become 100% partners in their healthcare decisions with their doctor. They're not making the decision, but they're making it with the doctor. And it's called shared decision making. And we're going to talk about that a little bit later. But empowered patients are educated, and empowered patients make better healthcare decisions. So the task for you is to become the CEO of your healthcare. Step 1 is to educate yourself. Do you truly understand the health crisis that you're facing? Research shows that you need to hear a message 7 times before you completely retain that information. And if it's during an initial diagnosis, you may be in emotional crisis, and therefore it's harder to retain that information. And let's face it, medical language can be really difficult to understand. So some tips there is you need to make sure that you're asking for clarification for a simpler explanation. Ask your doctor to use lay language and continue to listen to the message and ask for more clarification if you don't understand. Not only do you need to understand the diagnosis, but you need to know what the diagnosis means for you. Everybody is different, and everybody has a diagnosis that may change their life in different ways. So you need to understand your short-term and long-term prognosis. And is this a lifelong care situation versus a short-term treatment plan? For example, a broken arm may be a short-term treatment, right? You just need to get a cast, or if maybe it's surgery, you might have to do physical rehabilitation, and then you may be back in 6 months, you'll be back to the way you were before. Now, lifelong care, maybe it's a heart attack, maybe it is a cancer diagnosis that you need to have a long-term treatment. So you need to keep asking questions, knowing how this is going to affect your life short-term and long-term. And I love this picture because this is teamwork at its best, right? because you really want to be a part of that hospital or healthcare team. You want to, after you understand your diagnosis, because you can't be empowered if you don't know what you're up against, you want to ask for the diagnosis to be explained more, and make sure you're being heard when you're asking these questions. And don't always assume that the first option is best for you. So you need to start asking questions. What are my options? Are there other treatments or therapies that we could consider? You could even ask questions about, are you in the right place? Do you have the right healthcare team in place? Is there someone else that maybe you need to see? And are you weighing all of your options? Because the truth is, your voice matters. Your story matters. If you're uncomfortable with something, you need to speak up and ask for a solution. This one is really funny because he says, I hate cats, I want a dog scan. Sometimes you don't get what you want. Sometimes it's not available, but you need to ask and speak up and talk to them in a kind and considerate way, and always be respectable towards the medical team. And I think the most important thing in this part of the presentation is that if you're afraid, you need to say so. Don't be afraid to say that you're afraid. If you have to have a surgery or a long-term treatment, sometimes it's great to start asking questions before you wind up at the hospital. So before a surgery, you want to talk to them and ask them questions like, how often have you performed this procedure? What's your survival rate? What is the average recovery time at this hospital? What complications are likely to occur? How does the care team work together? And how do they handle patients with this condition? Now, note that the question about mortality rate at the hospital may not be a good indicator, because some hospitals take really high-risk patients, and therefore they have higher mortality rates because they're taking the high-risk patients and trying to save their life, and sometimes that turns into a high mortality rate for the hospital. So it's not always a great indicator. It's just one of those little tools in the box that you can start looking at when you're talking about, is this the right place for me to be? And not just with the medical information, but you also want to ask questions like, what resources are available for you at that hospital? Maybe you are looking at bringing a caregiver with you, and what resources do the caregivers have? How can they help you as a family with the resources that they have available? Some of the children's hospitals have Ronald McDonald houses, which is a huge asset to a hospital. But there are lots of other programs and resources that every hospital has that is very good for you to know when you're considering which hospital to have a surgery at. But you also need to take into consideration what will work for you. Will you be able to afford the treatment? Will you be able to obtain the medication and the therapy that's being prescribed? What lifestyle changes will you need to make? And do you have other options? And I just want to talk about this for a moment, because I think that sometimes we're in a situation where we know that this is maybe the best treatment, or the doctor is telling you it's the best treatment. But in the back of your mind, you're saying, there is no way I can sustain $250 a month for this prescription, and I don't have help with it. So you might be able to get it for 1 month, but what are the chances of you keeping and adhering to that medication month after month? You need to make sure that you're telling your doctor, look, I don't think I can sustain this long term. Is there a less expensive alternative that we could use that would be the same amount of money? Or we would be less money, but the same effectiveness. One time I was getting a prescription and it was $175. And I thought, that is so expensive. And my insurance didn't cover it, of course, for my son. But I found out after I paid it that had we given 2 medications that would have combined to make the exact medication that was prescribed. It just had a steroid in the medication. it would have been like $15. And so I didn't ask the doctor. I didn't say, hey, I can't afford this. And so those are the questions you need to ask. If you know that you can't afford that treatment, talk to your doctor before you leave that doctor's office. And then, you know, if it's a lifestyle change and you are considering the fact that maybe it's going to be really hard. I know as a smoker, some people say it's, you know, they just can't quit smoking. Let's just use that as an example. You need to make sure you're clear with your doctor. Look, I'm going to give it my best, but I don't know if I can quit, because then the doctors can help you find ways to help you make those lifestyle changes. Don't just say, okay, yep, I'll quit, and then walk out with no, you know, like, there's no way I'm going to be able to do this, because all you're doing is hurting your treatment when you do that. So let's be honest with our doctors and talk to them and make sure that the options and the treatments are going to actually work for you. Online research, proceed with caution, it says here. I found quickly that research on the internet and on the website is very difficult. You should use the research to prepare questions, but don't use it as facts, except for when you are on a website like the CDC or the NIH and you're simply getting facts. Because there are a lot of individual stories and people putting information on the internet, and it's not always right, it's not always accurate. And so you need to be really careful where you're getting your information from. Don't go to Wikipedia. Don't just blindly Google something. Connect with a disease-specific organization for information. I know at Mended Hearts, and there are disease-specific organizations for every disease topic. We vet all of our facts through medical review before we put anything out there. And so we are not just making facts up. And unfortunately, that happens a lot in research or in online. And then shared decision making requires a dialogue between provider and patient. And this is what we've been talking about the whole time, about how to make these shared decisions with your doctor. Having that provider and patient decision dialogue that goes back and forth. If you're educated and you understand the decision you're making and you have all of the information about all of the options, you need to make sure that you've been given time to digest and think about the situation. I don't know about you, but I've left a doctor's office and thought, oh man, I should have asked this question. And I just completely forgot. And you need to talk to your family and make sure your family is on the same page as you are and that you're confident in your decision. And this shared decision making is a lot different than it used to be. So it used to be the clinician, very paternalistic. The clinician would give you information, give you a treatment plan, their recommendations, and you would say, okay, and go home. Then they kind of moved into informed medical decision making, which was still pretty paternalistic, but they would give you more information and then say, you know, do you agree with this? But then finally, we've come to a point where patients really are at the center of this decision-making process. And you can take your values and your preferences of your lifestyle, put that in there with the information and the recommendations, and have a back and forth discussion with the clinician until you've come up with a decision that you feel good about. And I just want to go over a few rights that you have as a patient. You do have the right to be treated like a part of the team. You have a right to ask questions and get answers. You have a right to a second opinion or a third one or a fourth one. You have a right to suggest alternatives. You have a right to feel confident in the team. You have a right to change your mind. And you have the right to appeal decisions if you don't agree. Now, the appeals of decisions will be different depending upon your hospital or your clinic or the office, your states, but everybody has a right to appeal a decision if they don't agree with it. In talking about the importance of caregivers, having a supportive caregiver is really an important part of your journey. It's nice to have that caregiver attend the doctor's appointments with you and include them in conversations when applicable. Make sure that your caregiver feels empowered to ask questions about your care, because sometimes caregivers have a completely different insight, and it's really vital to include them. And obviously, having two sets of ears can help, because what you aren't hearing, the other person or your caregiver may be picking up on. So it's really important to have that strong, supportive caregiver in your journey if you have one. You need to take responsibility for those decisions that you make once you make them. Make sure that you're confident in that decision, but take responsibility for your treatment plan. You realize that you can change your mind if it's not working, but just communicate with your healthcare team at every step. Don't just quit a medication because you don't want to take it anymore. Talk to your doctor and say, look, this is giving me a side effect, or this is making me too sleepy and I can't take it. Is there something else we can take? Don't just quit your medication without telling your doctor. And that's voicing your concerns as well. And I think most importantly, you need to know you're not alone. This was really my biggest fear when my son was first diagnosed, is that how alone I felt. And connecting with other people can help you navigate your journey. I encourage you to find a support network within your disease-specific community where you can share your fears and struggles. You can get support for lifestyle changes, get emotional support. Even if it doesn't look like emotional support, just knowing you have a friend is so important. And then educational opportunities. Disease-specific organizations have lots of opportunities to be educated. And with that, I would like to turn it back over to you, Carla.
Fantastic. Thank you so much, Andrea. And I can tell from the responses and participation we're getting from attendees that this is clearly a topic that is resonating with everyone. And I'm getting also feedback, something that I will mirror, that I think it's invaluable that not only do you have your expertise as a leader of Mended Hearts, but that you share your personal experience and how you came about knowing that this was a topic of such importance, and on your mission to help people to become empowered patients. So I'm so glad that you took time out of your busy schedule to share this with the NeedyMeds audience, because I think just hearing it from you, um, it it because you're so plain spoken and relatable, that it really will make a difference in people's lives. And like I said, we're getting a lot of comments and questions from our audience, which we will get to momentarily. So thanks, everybody. I just also want to make sure that you guys are seeing my screen. Andrea, can you see my screen, which is a picture of you right now?
I cannot.
You cannot. So let's see. Let me grab it. How about now?
Now I can.
Fantastic. So thanks everybody for your patience with that. So as I said, as those questions are coming in, I want to remind everybody that NeedyMeds is also here as a source of support. Andrea mentioned a couple of times that sometimes an obstacle, certainly in your healthcare journey or that of a patient, a client, or a loved one, is the obstacle of being able to afford your medications or other healthcare costs. So I want to remind everybody that NeedyMeds is here to help you with that. If you are, as I mentioned in the beginning, looking for healthcare savings options, visit our website, needymeds.org, and check out that healthcare savings tab. And what you're looking at on the screen is a list of all the different categories that will pop up to help you save on your medications and other healthcare costs, because we all know that not every healthcare expense falls neatly into the category of medication. So please remember, we are here for that support. I also want to, as promised, as we get to those questions coming in, leave up the contact information for Andrea and Mended Hearts. So that's right on your screen at the top. And underneath that, of course, you'll see our NeedyMeds website as well as our 800 number for our call center. We are here weekdays, 9 a.m. to 5 p.m. We're in Massachusetts, so that's Eastern time, and we also have Spanish-speaking counselors. So let's go ahead and get to some of those questions coming in. And like I said, we'll do our best to answer all of the questions that do come in today, but if for some reason we don't get a chance to answer yours, we will follow up with you via email, or of course you can reach out to Mended Hearts or NeedyMeds. One thing I'm noticing that I didn't put up there is my email address. If you have any questions regarding NeedyMeds or our webinars, you can reach out to me, and it's Carla with a C, Carla@NeedyMeds.org. So one of the questions coming in, and actually I love this question because I'm really curious about what your response is, Andrea, because I do have some suggestions as well. And the question is, do you know about any suggestions for me to remember to take my medications?
Yeah, this is a really common struggle. And I will admit that I struggle myself. I don't seem to struggle with my son. I can always remember to give him his medicine. It's me. There are a few different things that we have found. Number one, that peer network is always great because people have lots of suggestions and love to share. Some of the great ones that we have had shared with us is that there are apps. If you are a tech person and into apps, that will alert you with an alarm that it's time to take your medicine. Um, Keeping your medication in a space where you see it every day. This doesn't always work with people with small children in the house, but if you want to put it beside your toothbrush and for your morning meds, you'll see it there. If you put it beside the kitchen, in by your dishes where you're getting for dinner, for your evening meds, making sure that you put it somewhere that's very easy to see, and then it will trigger it when you see it. Oh, yep, I got to take that. Those are the two most successful ideas that we have had through our peer network, as well as those little travel pill bottles that you can put your whole week of pills in, and then you'll see, oh, I didn't take it this morning, because sometimes I'll take it and forget, and I'll say, oh, did I take that medicine? Those are the three things that I would recommend.
Those are really helpful, and I really like that you had an opportunity, Andrea, to talk about how reaching out to peer-to-peer for peer-to-peer support is a big one, because a lot of people will have options that have worked for them that maybe you never thought about. So what I love is we're also getting some responses from our audience. So I'd love to go ahead and share those in addition to what Andrea's suggestion. One is we have an audience member who says, I use a dry erase board and an alarm on my phone as a medication reminder. I love that there's a suggestion there with a backup. I am one of those people that needs a backup. We're also getting a lot of feedback from our audience saying many of them seem to be writing and saying that they definitely use pill dispensers. And
Yeah.
I'm also happy to let you know that we do have one of our volunteers joining us for today's webinar, and she's reminding me that NeedyMeds has an app called Health Storylines. Health Storylines is a free app. You can download it for free on Google Play or iTunes App Store, and it won't be the solution for everyone. As Andrea said, if you're tech inclined, an app might work for you. So one of those apps might be Health Storylines. Again, it is free, and you can download it from Google Play or iTunes App Store. And the way we describe Health Storylines is a way to keep your health and manage your health, keep your health on track and manage your health conditions. And you can also manage the health conditions of maybe people you're a caregiver for. The great thing about the Health Storylines app is it does have a lot of customizable tools. And one of the tools in there is specifically a medication reminder. So you can learn more about that. You can go ahead, I recommend go ahead and download it and try it for yourself. But if you're interested in learning more, if you go to needymeds.org, on the left hand side towards the bottom, you will see a little box dedicated to health storylines. So click on that box and it'll take you to our health storylines page where you can go ahead and read a little bit more about it. So thanks for bringing that up to our volunteer, and thanks Andrea and those from the audience that are participating with these great suggestions. Another one coming in, Andrea. You've mentioned peer to peer. How, and the question coming in is, how do I find people in my area to get support from? That's a great question.
Yeah, that's a great question. So I would start by searching the patient organization that you're looking for, such as Mended Hearts. We have local support chapters. And I know that other organizations are the same way. They have local support. So if you start at their national website at like mendedhearts.org, and look for support near you. Like we have a map that says, you know, you can put your zip code in and it'll show you where the nearest chapter is. And also another great tool is to just ask a doctor or a hospital or your nurse, you know, are there any support groups in the area for the Alzheimer's Association or for heart disease? And they will always be able to give you some recommendations. That is typically where a lot of people get their referrals. And finally, people get referrals from their friends. Do you know of a group? A lot of people come to us because somebody has connected, and that is like the power of the patient, right? And you know, somebody says, I've been where you are and I know how you feel. And you say, really? I never had any idea. And they're like, come with me, you know, I'll show you the way. And so that's why it's so important to keep talking about your journey to everybody, and to share in your experiences with others.
It really is invaluable. Thank you for that, Andrea. And I'm going to take a moment actually because Andrea talked about reaching out to diagnosis specific organizations such as Mended Hearts to see if they offer or can point you in the direction of a support group or peer to peer support. On needymeds.org, under that healthcare savings tab, in the center section right at the top, you'll see a link for diagnosis information pages. And those are exactly what they sound like. We have an alphabetized list of diagnoses, and we partner with other reputable nonprofit organizations to host those pages. And on those pages, you will find up to date information about the diagnosis, but you will also find reputable hyperlinks in the resource box on the right hand side. And you may be able to find a support group listed there, but more importantly, you may be able to reach out to the organization that's hosting that page. Just visit their website and see if they do have a support group or a peer to peer type forum that you can reach out to people. I also wanted to mention these diagnosis information pages because Andrea stressed a bunch of times throughout her presentation that you want to be careful when you're doing research where you're getting your information from. She cautioned us all against from doing a random Google search and just getting our information on Wikipedia, instead visiting reputable organizations. I hope that you rely on those diagnosis information pages as reputable sources of information for diagnosis specific information. So please check those out. So thanks for giving me an opportunity to share that. Another question coming in for Andrea. And this is a delicate one, and I will say probably one that resonates with a lot of people. I'm a caregiver, and my husband is telling the doctor that he feels great, but I know he's really depressed. How can I help if my husband isn't telling the doctor the truth? That's a really good question and really delicate. So our audience wants to know, Andrea, if you have some suggestions about that situation.
Yeah, it's always a really hard decision and a situation that you have to handle very gently. And coming from experience, I can tell you that husbands always say they feel great, right? I'm like, no, you need to go to the doctor. Um, First and foremost, have a conversation with your husband. You want to make sure to always honor his ability to make his own choices in his healthcare decisions. You, as a caregiver, you don't want to overstep, but you want to make sure that he understands how you feel and explain to him. In the perfect scenario, you could have a conversation with him and explain to him that you see, without blaming or pointing fingers, say, I have noticed that you seem to be a little more depressed than usual. Is this something that we could talk to the doctor about at your next visit? I'm happy to come with you and speak to the doctor with you. Because you always want the patient to be on board with anything that you're doing, because that is so vital, for the patient to really feel empowered. But maybe he needs some empowerment. He needs to know that this is okay. He's not alone. If we go to the doctor, and maybe the doctor can help you, and let him know that you'll be there for him.
Thank you so much, Andrea. That's a really it's a really delicate situation, and I think your suggestion offers a really good place to start. I can see how important it is, as you said, to make sure that the person you're attempting to help make sure you honor that they're included and feel empowered in their own decision making process. And thank you to our audience for being so participatory, because I always feel, and I say this in every webinar, that if you're thinking about something, whether it's a question or a comment to share, the chances are somebody else is thinking the same thing. Before we move on to another question, one other resource I wanted to share with everybody, so I'm just going to pop right up on the screen. We also host, we being NeedyMeds, we also host a website called Be MedWise. And that's what you're looking on your screen right now. And Be MedWise is, as you can see, it's dedicated to patient information and education, and it's mostly dedicated to the safe use, storage, and disposal of medicines. But what I wanted to show you is it has a ton of information that I think would be appropriate to this topic of becoming an important patient, because Andrea talked about making sure you ask questions. And actually on bmedwise.org, we have a whole category, a whole tab dedicated to asking questions. So check out bmedwise.org to see if there's some tools that you and your loved ones or the people you're caring for would find useful. So thanks for giving me an opportunity to share that. So Andrea, another question coming in is, this is a good one. What do I do if I really want to try a new medication that I've heard is working well for others, but my doctor's telling me it's not really any better than what I'm on now? How do you handle that?
Well, I think that if you're having the conversation with your doctor and you have shown him some factual information, factual data, that can back up your question, I love this idea of this medication because of, not just because somebody told you about it, but because of the less side effects, or that the fact that it's less expensive, or that there are better results in clinical trials. Having that conversation with your doctor is really important. And most doctors, they aren't as steadfast as you might think. Some of them are very open to possibilities and ideas if they think there's something there that they could help you with. I would go that route first. And if it's a situation that you don't trust your doctor, I think that brings up a whole different ballgame of maybe you're not with the right physician if you aren't really having a trusting relationship with them.
Oh, that's such a good point. That is a really good point. Something for us all to think about. Well, with that, we're going to go ahead and thank again Andrea for taking time out of her day to share her expertise with the NeedyMeds audience, and to our audience for joining us today. One of the questions coming in that I will answer before we wrap up is whether or not today's presentation is being recorded. So here's the good news. For those of you that have attended after today's webinar, you will get an after the webinar survey, which we hope you respond to, but you will also receive automatically a recording of the webinar. It's not the most user-friendly recording, and you can't share it with other people. So in addition to that, we will work to convert today's presentation into a video. We'll post it to our YouTube page, and I'm happy to email it to you as soon as that video is available. It usually takes us a few days because, like a lot of other organizations, we're not able to have a lot of staff in the office because of the pandemic, and the equipment we need to convert the webinar into a video is in the office. So there may be a bit of delay, but rest assured we will get you that. And if you drop me an email or send me a message and you would like a link to that video, I'd be happy to send it to you as soon as it's available. I also recommend subscribing to the NeedyMeds YouTube channel. And again, you can do that by clicking on our YouTube icon on the top right side of NeedyMeds.org. That's a great way to make sure you never miss any of our videos, webinars, or presentations. So with that, again, thank you everybody for joining us today. And Andrea, thanks so much for being here. If you did ask a question that we didn't get a chance to answer, we will follow up with you by email. But of course, you can reach out to Mended Hearts or NeedyMeds anytime. Have a great rest of the day, everyone, and we do hope we see your name pop up in future webinars. Take care. Thank you.
Thank you.